Good afternoon. My name is Ashley Harris, and I'm going to provide an overview of the bills impacting child welfare. Please note there have been a lot of bills filed, and I will not address many of the bills highlighted on the slide. Next slide. Due to recent high-profile cases where victims of child abuse and neglect were not addressed, many bills have been filed this session that relate to training and reporting of child abuse and neglect. We are closely tracking Senate Bill 939, also known as the Child Protection Act. This bill would require institutions of higher education, schools, and charter schools to provide professional training to new and existing staff on preventing, recognizing, and reporting suspected child abuse. To ensure all these institutions implement, and also to ensure all institutions implement written recognition and reporting policies consistent with state mandatory reporting laws. To ensure that there won't be staff keeping certain concerns hidden. To ensure school districts have a more uniform procedure for reporting, House Bill 135 would require the Texas Education Agency to develop a policy regarding reports of suspected child abuse or neglect. The policy must require each school district employee to report suspected child abuse or neglect as required by the Family Code. To ensure school staff suspecting abuse and neglect directly report to CPS and not rely on another staff person like the principal or counselor, with this bill, professionals may not delegate to or rely on another person to make the report. As it relates to human trafficking prevention, House Bill 2393 would require training of DSPS employees and other HHSC staff on human trafficking. Currently, caseworkers at CPS do not receive training on this major issue and would be valuable given that so many youth served by CPS are victims of these crimes. Also, there are a few bills filed that address reporting standards and penalties for not reporting child abuse and neglect, and additional liabilities for college campuses to ensure protections for children attending summer camps, after-school programs at these institutions of higher education. Senate Bill 384 increases the range of penalties for professionals who fail to report abuse and have an intent to deceive. House Bill 443 adds additional liability to colleges and universities for staff who don't report and requires additional training for staff at these campuses. Next slide. Although not directly related to the prevention of child abuse and neglect, I want to highlight Senate Bill 423 that creates a differential response system for CPS. This is where families that do not pose an imminent risk to a child's safety can go through a different investigations track at CPS. This track will be more holistic with the ultimate goal of family preservation. Other related bills aimed at prevention include Senate Bill 426 that expands home visiting programs and creates an accountability structure to ensure these programs promote the best outcomes for preventing child abuse and neglect. And House Bill 1633 would create an advisory committee to study child deaths due to abuse and neglect. Now, next slide, please. Now I want to highlight bills directly related to our foster care system and efforts to improve the services and outcomes provided to children and families. The education outcomes of youth in foster care remain poor, and we want to address their barriers to success. Many youth experience multiple placement change, often changing schools and impacting the timely school enrollment, withdrawal, and transfers of youth in care. House Bill 456 builds on a bill passed last session that created the school liaison position in each school district to assist these youth with the withdrawal and enrollment process. And House Bill 456 would require training for these positions, and that TA would compile the list of these these individuals to ensure that training can be targeted. Also, we have been working on House Bill 457 that would create a student demographic code for foster youth through the PEAMS code. Other bills related to education and foster youth include House Bill 2619 that would ensure an education decision maker is named by CPS, and Senate Bill 1404 would promote more timely graduation of youth in foster care by allowing for partial credits to be accepted towards graduation and the review of a youth personal graduation plan. Foster and relative caregivers provide the security and support needed for a child impacted by abuse and neglect, and there have been many bills filed aimed at addressing the needs of these substitute caregivers. House Bill 1180 is based on a current practice in Travis County that requires all parties to reach an agreement on a proposed placement change before CPS can actually make the placement for a child, unless it is an emergency. I also want to highlight House Bill 1209 would lessen the time frame in which relatives can request legal standing in a case after a parent's rights have been terminated. Currently, relatives have up to 90 days to file, and this bill would move it to 30 days. Although this bill's intent is to get children to permanency more quickly, this could hinder many relatives who may not have information about a child from being a viable option for a child in foster care. Next slide. We continue to work to improve the behavioral assessments used in the child welfare system. In a priority bill, House Bill 1143 would require all children to receive a comprehensive multidisciplinary assessment within 30 days of entering care, including a trauma screening. This is a large bill that also includes provisions that would require prior authorization of psychotropic drugs for certain children, analysis of trends of psychotropic medication use, and would provide kids living in Texas but in the custody of another state and dual-eligible Medicaid, Medicare kids the same protections and monitoring of medications that other children in foster care receive through Star Health. Other bills that aim to strengthen accountability measures for when psychotropic medications are prescribed to children in foster care and promote appropriate diagnosis and treatment of children in care include House Bill 915 by Colcourse that would require a youth transition plan to include assistance with managing or getting off medication once they leave care, informed consent measures, parent notification of prescriptions given to children, judicial review on non-medication interventions and plans to discontinue meds if appropriate, in-person visits between child and their clinician every 90 days, and similar provisions to House Bill 1143 that would ensure children in the custody of another state and dual-eligible kids have the same protections and monitoring as all other youth in foster care. We are also tracking many bills that aim to improve the services and outcomes of children and families, including getting children more involved in their case planning and decision-making. With our priority bill, House Bill 843 by Lucio, DFPS would be required to notify children 10 and older of their permanency and placement hearings. Also, as a former CPS caseworker, I know firsthand the struggles that frontline workers face, and we support Senate Bill 1748 that would require DFPS to work towards capping caseloads for all program areas if funds are available. Next slide. Other bills that relate to the foster care system include House Bill 3431 that creates language about the new contracts for the foster care redesign process. And I want to note that youth aging out of care have faced many barriers to success, and we want to support savings opportunities for these youth. House Bill 445 would create a match savings program for these youth, and House Bill 1634 would promote more experiential learning opportunities related to financial security. Additionally, we are closely tracking House Bill 644 and Senate Bill 1210 that would create additional eligibility requirements for the tuition and fee waiver, and this may impact a youth's ability to utilize this resource to achieve academic success and become a more productive adult. Lastly, as an organization, we have always defended against punitive measures that hinder a parent's ability to be involved and engaged in the process and services to help them heal and become a safe home for their child. In this session, we have opposed House Bill 165 that would move the time frame in which foster parents can seek legal standing in a case from 12 months to 6 months and 3 months for children under 2. We feel this bill challenges the state's ability to promote reunification with the child's family of origin, and similarly, House Bill 2321 would move the opportunity for foster parents to seek legal standing to 6 months versus 12 if the child has been previously removed. Before I wrap up, I want to acknowledge Senate Bill 352 and its companion, House Bill 1453, that supports our priority of family reunification and parental involvement and would raise the minimum visitation standards and practice for all children in temporary managing conservatorship of DFPS if children have a permanency goal of reunification. Thank you so much.